resistance to come be part of a debate like this. And I think that bodes very well. But you're right. We've got to change the way we deliver care and the way we pay for it and what we incentivize. We have to incentivize best practices. Yes.
Hi, I'm Charlotte Flowers from the Women's Foundation of Minnesota, and I'll go quick because we fund a lot of the organizations that are at this table. So we've been supporting this work kind of on a grassroots level for a number of years and would like to see some big systems change happen around access, around getting ideology out of women's healthcare issues. You know, there aren't any other healthcare issues that face as much public scrutiny as women's reproductive healthcare does. The other issue is around that kind of two Minnesotas idea and the disparities for women of color. And it's about access partially, but it's also about making healthcare providers sensitive to cultural differences. And for example, while contraction rates aren't higher for breast cancer for African American women, mortality rates are higher. And we funded a program that had sort of healthcare navigators that would go through the process with African American women to help them get better outcomes for their breast cancer care. And while that's an innovative solution on the ground, what we need ultimately is to have systems change within the healthcare system so that it doesn't matter what your background is as you're coming in for care, that you're going to get the same treatment and have the same outcomes, the best outcomes. So that is all I will say, but thanks.
Well, thank you.
Yeah.
Didn't Michelle Watkins say the other day about our healthcare system that we have to get the government
off our decisions in our bodies?
Yeah, yeah.
That's crazy now.
Hi, I'm Melissa Nambandi from the Minnesota African Women's Association, and I have a picture with you on Facebook. Very much. A lot of what concerns us, especially African immigrant women here, has been mentioned already, and Bonnie's points here really bring that up. I just wanted to reiterate a couple of things. First of all, of course, the out-of-pocket, the co-payments and all of that is just so difficult for our women because they mostly fall in the low-income range, and coming from countries where they didn't have to do this, it's like, don't they want me to get well or what? So that's one of the things. Supporting programs, school programs, especially in comprehensive sex education, is so important for our youth because of our culture where the family do not discuss this with the children. It's mostly done in schools. And we have a girls program, youth program, that leadership program, Agile, that we've been doing for several years now. And it is just startling to us every year how much higher the teen pregnancy rates are, especially within certain communities, refugee communities with all the other impacts of the war. In fact, 2 years ago, one school in Brooklyn Park started this new school year with 24 pregnant teens, and 18 were from one African community. So that's a really bad statistic, which we know that comprehensive sex education in school programs would really help. It's well known, we are immigrants, but we are mostly legal immigrants. I don't know that we have many illegal immigrants among the African population, but the truth is we also have poorer access to healthcare generally. So those are some of the things that I just wanted to hear about the gateway, because as a small non-profit, that's one of our big issues with how we're going to deal with having benefits.